Hey you guys, and welcome to the first episode to a series of videos regarding the heart. Since the heart is a quite complex muscle, we're going to start by introducing and understanding the anatomical structure of the heart and the route of the blood through the heart. In the next video, we are going to go through the cardiac cycle, and by the end of that video, you will be able to understand and read the ECG, which is the electrocardiogram. But for now, we're going to talk about this, which is the heart. And this muscle may seem difficult to understand, but it has a very logical and easy explanation to its shape. As you can see, the heart is divided into chambers. One here, here, and here. And that is a total of 4 chambers. And these chambers will get filled with blood and later pump, with the help of the muscles, pump the blood throughout the heart and to the whole body. So the 4 chambers is known as the right atrium, the right ventricle, left atrium, and the left ventricle. So there are 2 upper chambers, which are known as the atrium, the atria, and then we have the 2 lower chambers, which are the ventricles. And blood passes through a valve before leaving each chamber of the heart. So the blood will fill here, and then the muscles will contract and push the blood from the right atrium through the tricuspid valve, which is located here, to the right ventricle, and then the tricuspid valves will close behind, and when the right ventricles start to contract, the blood will get pushed from here up to the pulmonary valves and to this area over here. On the other side, on the left side of the heart, so you may think, why is she saying left when it's right? So everything is on the other side. When you're looking at an anatomical picture of the body. So everything that says right is left and the other way around. So the left atrium here, when the left atrium gets filled with blood, the blood will pass through here, which is called the mitral valve, into the left ventricle and then close behind. And then when the left ventricles start to contract, the blood will get pushed up to the aortic valve. And as I was saying earlier, the right atrium gets filled with blood, and the blood will come from the superior vena cava and the inferior vena cava and fill this chamber with blood. And then, as I was saying, the right atrium will get filled with blood, get pushed down through the tricuspid valves to the right ventricles, and then the right ventricle will push the blood through the pulmonary valve into the pulmonary arteries. And then on the pulmonary arteries are connected to the lungs, actually. So this will be the left lung, and here over here we have the right lung. And then the blood will go through the lungs, and then they will re-enter the heart here, which is known as the pulmonary veins. And it is the same on the other side. So this is also the pulmonary veins. And the pulmonary veins will transport the blood from the lungs into the left atrium, through the mitral valves, which are located here, into the left ventricles. Then when the left ventricle contracts, it will push the blood through the aortic valve into the aorta, or also known as the arc. So the cardiac valves that we were talking about are the tricuspid valve, which is located here between the right atrium and the right ventricle. We have the pulmonary valve, which is located between the right ventricle here and the pulmonary artery here. Then we have the mitral valve, which is located here. Don't mistake it for here. It ends here. And this valve is located between the left atrium and the left ventricle, and it only has 2 leaves. And then we have the aortic valve, which is located here, and it separates the left ventricle from the aorta. So how do the valves stop the backflow of the blood? Because when the heart, for example, when the right atrium gets filled with blood and it starts to push the blood through the tricuspid valve into the right ventricle, then the right ventricle will start to contract and push the blood up. How come the blood does not flow back into the right atrium again? So as the heart muscles contract and relaxes, the valves open and shut. The left lets blood flow into the ventricles and atria at alternate times. So when the left ventricles relaxes, the aortic valves closes and the mitral valve opens. This lets blood flow from the left atrium into the left ventricle. The left atrium contracts. This lets even more blood to flow into the left ventricle. And when the left ventricle contracts, which is here, when the left ventricle contracts, the mitral valves closes and the aortic valves open. This is so blood flows into the aorta and out to the rest of the body. While the left ventricles is relaxing, the right ventricles also relaxes. This causes the pulmonary valves to close and the tricuspid valve to open. This lets blood flow into the right ventricles that was returned to the right atria for the body. And when the left ventricles contracts, the right ventricles also contracts. This causes the pulmonary valves to open and the tricuspid valves to close. Blood flows out from the right ventricles to the lungs before it returns to the left atrium as fresh oxygenated blood. And as you can see here, part of the heart is blue and part is red. And there is a reasonable explanation to that. It is not that the heart is partially blue and partially red. It's actually all of it is red. But the reason why half of the heart is blue is because for a better understanding of the blood through the heart. The blue part symbolizes the oxygen-poor blood that enters the right atrium through the superior and inferior vena cava. So that was a very brief introduction to the anatomical structure of the heart. As I was saying, I'm going to go through each and every single step of the heart very briefly and very in shorter videos because it can be a lot to comprehend. But don't worry, there are coming more videos and we will go more in depth. But this will be the end of it for part 1. Please subscribe and leave a comment below if you have any feedback you want to give us or if there are any specific subjects you would like to learn about. Thank you so much. Bye.